Imagine walking into a room and being told that everything you thought you knew about prostate cancer treatment might already be outdated. That's exactly the feeling that came out of this conversation, because what's happening in prostate cancer care right now is a quiet revolution, and most people outside the medical world have no idea it's even happening. For years, prostate radiation meant one thing: weeks and weeks of daily treatment. 6, 7, sometimes even 8 weeks of back and forth to the hospital. And for many men, that alone felt overwhelming. So let me ask you this: what if you could get the same cancer control in just a few visits instead of months? That's not science fiction anymore. With modern, high-precision radiation, doctors can now safely deliver higher doses in fewer sessions. In many cases, treatment is done in 5 sessions, and in very select situations, even 2. And here's the part that surprises most people: long-term cancer control is just as strong as it was with the old, drawn-out schedules. Now, your next thought might be, that sounds risky. Bigger doses must mean more side effects, right? That would have been true years ago, but today's radiation machines can track movement, image the prostate in real time, and tightly focus the dose where it's needed. That means less exposure to the bladder and bowel, and fewer lasting side effects for most patients. Shorter treatment doesn't mean rushed treatment, it means smarter, more precise treatment. Then there's hormone therapy, and this is often the part patients fear the most. Hot flashes, fatigue, mood changes, muscle loss. It's not something anyone looks forward to. So the big question is, does everyone really need it? The answer is no. Some men benefit from hormone therapy, but many don't. For certain intermediate risk cancers, radiation alone can work extremely well. For higher risk disease, hormones still matter, but doctors are actively rethinking how long they're truly needed. Instead of years of treatment, newer strategies are testing shorter, more targeted approaches that aim to protect quality of life without sacrificing cancer control. And there's something else that doesn't get talked about enough. Recovery from hormone therapy isn't the same for everyone. Older men often take much longer to recover their energy and strength. That's why exercise, muscle health, and overall fitness aren't optional add-ons. They're critical parts of care. Treating cancer isn't just about survival anymore. It's about how well someone lives during and after treatment. Now let's talk about something that feels futuristic, but is already here. With advanced PET scans, doctors can now see tiny spots of cancer that were completely invisible in the past. When those spots show up, it's tempting to immediately zap them with targeted radiation. And in many cases, doing exactly that can delay more aggressive treatments and keep the disease quiet for years. Some patients do remarkably well with this approach, but here's the catch. Just because you can see 1 or 2 spots doesn't mean that's all the cancer there is. Microscopic disease can still be hiding. That's why research is showing that, in certain situations, treating a wider area, like the pelvic lymph nodes, can lead to better long-term outcomes than only treating what shows up on the scan. It sounds counterintuitive, but when done properly, broader treatment doesn't necessarily mean more side effects. So where does this leave surgery, radiation, and all the choices patients hear about? The truth is, there's no single best option for everyone. Some men benefit from surgery, others do just as well with modern radiation without an operation. And sometimes, a carefully planned combination of treatments offers the best balance of cancer control and quality of life. What's most exciting isn't just one new machine or one new drug. It's the direction everything is moving. Better imaging, smarter software, artificial intelligence that can help predict side effects and outcomes before treatment even starts. Imagine sitting down with your doctor and being able to see ahead of time how different treatment choices might affect your daily life. That's where prostate cancer care is heading. So if you remember one thing from all of this, remember this: prostate cancer treatment is becoming shorter, more precise, and more personalized than ever before. Cure rates are already very high. The next goal is protecting quality of life while keeping cancer firmly under control. And that raises the most important question of all. If you or someone you love were facing prostate cancer today, wouldn't you want to know what modern treatment can really offer now?